Bulimia nervosa is an eating disorder, mental health issue. Look at this picture shows that being eating behavior. After that, compensatory inappropriate behaviors. Look at this: self-vomiting, misuse of laxatives. Look at this. A detail going on. Introduction. Bulimia nervosa is a serious and potentially life-threatening eating disorder characterized by cycle of binge eating followed by compensatory behaviors such as purging. It is a psychological disorder that often coexists with other mental health issues, significantly affecting physical health and emotional well-being. Etymology. The term bulimia nervosa originates from the Greek word boos, ox, and limos, hunger, meaning ox-like hunger, reflecting the intense episodes of overeating characteristics of the disorder. The addition of nervosa signifies its psychological roots, indicating an emotional or mental origin linked to body image and self perception. A definition: Bulimia nervosa is defined as a psychiatric disorder involving recurrent episodes of binge eating accompanied by a sense of a lack of control over eating during the episode, followed by inappropriate compensatory behaviors to prevent weight gain, such as vomiting, fasting, excessive exercise, or misuse of laxatives and diuretics. Type 1. Purging types involves regular self-induced vomiting or misuse of laxatives, diuretics, or enemas after binge eating. 2. Non-purging type involves other inappropriate compensatory behaviors such as fasting or excessive exercise but without purging. Causes. An exact cause of bulimia nervosa is not known but is believed to result from a combination of genetic, environmental, psychological, and sociological factors. These include: 1. Genetics, a family history of eating disorder or mental health issues. 2. Psychological factors, low self esteem, body dissatisfaction, and perfectionism. 3. Socio-cultural influences, cultural pressure to conform to idealized body shapes, For trauma, history of abuse or other traumatic experiences. Risk factors 1. Gender, more common in females. 2. Age, typically begins in adolescence or early adulthood. 3. Societal emphasis on thinness. 4. History of diet or weight fluctuations. 5. Coexisting mental health disorders, example depression, anxiety, substance abuse. Complications 1. Physical complications, electrolyte imbalances, gastrointestinal problems, dental erosion, swollen salivary glands, and irregular heart rhythms. 2. Psychological complications, severe depression, anxiety, and an increased risk of suicidal ideation. 3. Social and functional impairments, strained relationship and difficulties in maintaining work or academic performance. Pathophysiology. The pathophysiology of BULIMIA nervosa involves disruptions in the brain's regulatory mechanisms for appetite and mood. Altered serotonin levels are often implicated, contributing to mood dysregulation and impulsive behaviors. Repeated bugging can lead to severe metabolic and electrolyte imbalances, placing significant strain on the cardiovascular and gastrointestinal systems. Below is step-by-step outline of the process that contribute to the development and perpetuation of BULIMIA nervosa. 1. Predisposing factors including genetic vulnerability, environmental triggers, psychological factors. 2. Onset and reinforcement disordered eating behaviors, including dietary restrictions and cognitive distractions, being episodes, compensatory behaviors. 3. Neurobiological dysregulation, dopaminergic system, serotonergic system, hypothalamic pituitary adrenal axis dysregulation. 4. Psychological and behavioral cycles, guilt and shame, cognitive behavioral cycle. 5. Physical consequences, electrolyte imbalances, gastrointestinal and dental issues, endocrine and metabolic changes, 6. Long-term impact. Chronic exposure to these biological and psychological stressors can lead to increased risk of comorbid psychiatric disorders, example depression, substance abuse, long-term damage to physical health systems, example cardiovascular, renal, and bone health. Signs and symptoms. 1. Behavioral. Secretive eating behaviors, frequent visits to the bathroom after meals, and excessive concern with body weight. To physical, swollen cheeks, calluses on the knuckles from induced vomiting, and fluctuating weight. 3. Psychological, preoccupation with food, feeling of guilt or shame after eating, and mood swing. A diagnosis. Diagnosing is based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, which include recurrent episodes of binge eating and compensatory behaviors occurring at least once a week for 3 months. A. Through medical history, physical examination, and psychological evaluation are essential. Nursing diagnosis. 1. Imbalanced nutrition, less than body requirement. 2. Disturbed body image. 3. Ineffective coping. 4. Risk for electrolyte imbalance. 5. Chronic low self-esteem. Management, medical management. 1. Pharmacological therapy, antidepressants, particularly selective serotonin reuptake inhibitors SSRIs are commonly used. 2. Nutritional rehabilitation, developing balanced meal plans with help of a dietitian. 3. Monitoring, regular monitoring of vital signs, weight and laboratory parameters. Nursing management. 1. Establish a therapeutic relationship to build trust and rapport, to educate the patient and family about the disorders. 3. Monitor for complications such as dehydration and electrolyte imbalances. 4. Provide support for healthy coping strategies. 5. Promote a safe environment for discussing feelings and concerns. Treatment options. 1. Cognitive behavioral therapy CBT, the gold standard for treating BULIMIA nervosa. focusing on modifying dysfunctional thought patterns. 2. Interpersonal therapy IPT addresses interpersonal issues contributing to the disorder. 3. Group therapy provides peer support and shared experiences. 4. Family based therapy involves family members in the treatment process. 5. Medication use of SSRIs to manage associated depression and anxiety. Psychosocial medicine 1. Psychoeducation to improve understanding of the disorder. 2. Stress management techniques such as mindfulness and relaxation exercises. 3. Developing social support networks. 4. Enhancing self esteem and body image. 5. Encouraging hobbies and interest to reduce focus on weight and appearance. Prevention 1. Promote healthy attitudes about food and body image. 2. Educate about the dangers of dieting and the importance of balanced nutrition. 3. Encourage open communication about feeling and emotions. 4. Early intervention for individuals at risk. 5. Advocacy for societal changes to reduce the stigma around mental health and body image. In conclusion, bulimia nervosa is a complex disorder requiring a multidisciplinary approach for effective management. Early detection and comprehensive treatment can improve outcomes, reduce complications, and enhance the quality of life for those affected. Thank you. Have a wonderful day.